Welcome to Caring's latest webinar. Today we'll be discussing how to effectively respond to reviews from seniors and their families about your senior living and senior care services. I'm Denise Graab, a marketing director here at Caring, and I'm thrilled you could join us here today. Before I begin the presentation, I want to let you know this is a one-way webcast where only the presenter speaks. You can ask questions at any time during the session. We're going to do a Q&A at the end. And the number one question we get is the session being recorded? The answer is yes. And will we provide the slides afterward? The answer is yes. We'll be sending it to all of you tomorrow via email, and it'll be on partners.caring.com so that you can share it with colleagues, revisit the slides, so you don't have to worry about that during this. You can just focus on the information and asking your questions. And we also got a question if I could hear and see you. I can see who is participating. Other people in the webinar cannot see or hear you. This is a one-way webcast. I'm going to go ahead and turn off my video at this time, and I'm going to come back on when we do the Q&A. I want to maximize the bandwidth and focus on the information. Many of you are Caring partners, and you're very familiar with our extensive expertise in digital marketing and online reviews. These are just a few of the highlights as a refresher, and for those of you who are new, Caring.com is a leading referral service for senior living and senior care, and the longest standing, highest integrity review site for our industry, with authentic consumer feedback about assisted living, in-home care, independent living, memory care, care homes, hospice, and more. We were one of the first to offer senior living and senior care reviews online, with some reviews on our website dating back to 2008. We currently host more than 375,000 consumer reviews across Caring.com and 2 other websites we own, and we receive thousands of reviews from seniors and their families every month. And each year, we compile the Caring Stars list of the best senior living communities and senior care agencies nationwide, using both those consumer ratings and the business review responses on Caring.com. This Service Excellence Award was the first of its kind in our industry, and overall, we are known for hosting a very high integrity reviews program with senior care experts, not algorithms, reading the reviews before they get posted on the website. We have well-established guidelines that determine which reviews get published and which reviews are declined or taken down. And we have customer service staff available by phone or email to help anyone that needs help with our reviews program. For those of you who aren't already familiar with me, I've been at Caring for over 13 years, and I have extensive experience in social media marketing and reviews in particular. In fact, I was part of the original expert panel that created the Caring Reviews program, the guidelines, the Caring Stars program. I support seniors and their families in adding valid reviews, and I work with communities and agencies to help them build and optimize online reputation and respond to reviews. Before Caring, I curated thousands of consumer reviews for an education website and schools directory. So overall, a lot of experience in this area, and I'm excited to share my insights with you today. Here's what we're going to focus on. We'll start with the importance of why you should respond to reviews, why it's worth your time. We're not going to spend a lot of time there, but with a few key things you should know. And then we're going to talk about the options of responding versus removals. And we'll cover the do's and don'ts of review response and what to say and what to avoid saying. And we'll have specific examples and tips from some of our reputation management partners. And as I mentioned, we're going to have a Q&A, so I want to be sure to get all of your questions answered. Speaking of which, when you registered for this webinar, you may recall an optional question I asked of you. What's your organization's biggest challenge in responding to online reviews? We received close to 200 responses to that question. However, surprisingly, 42% didn't see their biggest challenge in the dropdown. So that had me very, very curious. So if you were among those who chose other, I would love to hear that challenge. You can go ahead and put it in the chat box. And it will only go to me. You don't have to worry about your competitors or others in the industry seeing what your biggest challenge is. Put that in the chat box. I'm curious to know what we missed in our question survey, or email reviews@caring.com. But for those who did see their biggest challenge, there was 33%, or a third, who lack the expertise, staff, or tools to respond to reviews. They don't know where to begin. 16% are concerned about what to say in the response, particularly with negative reviews. And less than 10% just want those reviews to go away. They want no further engagement with the reviewer. I'm glad to see that number has been shrinking over the years. People are beginning to understand that you really need to build your online reputation and respond to those. And I want to thank everyone for responding to that question, including those of you who have been adding your challenges in chat. Really helps us to better serve you. And I've compiled some practical info today for all of the challenges we did initially think of. So let's get started. Without further ado, let's discuss some of the strategic reasons that you should be responding to online reviews. Nowadays, your potential customers are perusing your online reputation before they're expressing interest in your services, before they take tours, before they return your calls, after they've seen enough reviews to persuade them to do so. You may have heard us refer to this as the modern drive-by. Search engines and online directories are showing ratings as commonplace in those search results. The reviews are helping businesses rank and stand out from their competitors, and nearly all US consumers are seeking out online reviews when they're researching local businesses. And they are not just looking at one review website, they are looking at multiple review websites. They don't want to see the same review on each of those sites. They want to see unique reviews on each of the sites they visit. But it's not just the reviews they're looking at. They're also very interested to see if and how you have responded to that feedback from your customers. It can help them feel more positively about doing business with you. Here's data from the latest study that search engine marketing firm Bright Local has done among US consumers. 88% say they are likely to use a business if it responds to both positive and negative reviews. Um, and but if you can't respond to all, at least respond to the negative ones. More than half are influenced by you doing that. And if you're failing to respond to reviews, you may be losing business as a result of not responding to reviews. Half of people said they're unlikely to use you if they don't see you responding to reviews. Having online reviews and responding to them can also help you drive even more online reputation for your business. This is from Harvard Business Review, and one of our national partners was in one of my webinars, saw this data, and put it to the test with their portfolio of senior living communities, and they found it to be true. Within 6 months of responding to reviews, both positive and negative, you can see a lift in both the volume of reviews you get as well as a higher overall average rating. Another key reason to respond to online reviews, particularly negative ones, is to be considered for the Caring Stars Award. One long-standing requirement we've had in this program is that you must publish a response to every 1-star or 2-star review on the caring.com listing, not just the recent ones, any 1-star or 2-star review, or effectively contest and remove that review by the deadline. The Caring Stars 2025 qualification deadline is October 15th of this year. We'll have more information about Caring Stars in the coming months, and we also have the 2024 award information linked from near the top of our homepage, but you can also reach out to reviews@caring.com. We're happy to answer any questions you have about Caring Stars. So now that you understand why review response is so important, let's now discuss how to monitor for the reviews and the options of requesting removals versus publishing responses. Nowadays, you can't really hide from or ignore your online reputation, and this is really important. You can't force people not to write reviews about you online either. The 2016 Consumer Review Fairness Act established that businesses cannot include such provisions in their contracts with their customers. You can't penalize or charge higher fees to someone for giving you a negative review online. And conversely, you can't enter into an agreement that gives them a discount if they take down a negative review. These are just a few of the legal requirements and guidelines surrounding consumers' right and ability to post their honest feedback online publicly about the products and services they use. So instead of trying to prevent reviews from happening, focus instead on knowing what people are saying about your business online and taking strategic action to manage your reputation. And being here today is a step in that direction. I'm glad you, once again, I'm glad you could join us. So my first step or tip for you is to establish a plan for monitoring your reviews with tools and processes to help you do it at scale. These are the three main ways to do it. Some review websites will offer businesses automated and instant alerts by email whenever a new review is posted about their services. And each site is different in the requirements to sign up for those alerts. So determine where you want to focus your efforts, where you're getting the most reviews, which sites are ranking the highest or easiest for your potential customers to find and read those reviews, and then reach out and learn more about your options for that particular site. There are also reputation management companies that offer software platforms to help you monitor your reputation across multiple websites all at once. They've established integrations with the various review sites, and they've compiled the review data in one place where you log in and manage responding to reviews. They typically also have other services like reporting and reputation analysis. This is particularly good if you're a large business with many locations. If you can't get alerts or you don't have a subscription for monitoring and responding, you can keep a spreadsheet of links to your profiles on the key sites most important to your online reputation. Visit them daily or weekly to see new reviews. This last option is the most time-intensive, slowest, and least effective, but it is a workaround you could take advantage if the other solutions aren't open to you. Now, when you get a new review, ask yourself some questions and consider your options to determine the best course of action. Have you read the review guidelines for that review website where it's appearing? Excuse me. And do you see anything in the review's content that you think doesn't meet the guidelines? If so, flag that review to the site for the reevaluation of it being published. I'm getting some feedback that some of you are having trouble hearing me. I'm going to see if I can increase my volume. See if that helps. Terribly sorry. I do have all my applications turned off and the video off. So I'm very sorry if Zoom and the audio is cutting out for you. I apologize for that. We will have the recording available afterward. Okay, so back to the decision. You can also, if it's on caring.com, we have the option of contesting the review if it has fact-based errors. That's not an option on all of the review websites. It's not an option on Google and SiteJabber, for instance, and some of the others won't allow taking down a review for factual error. But Caring, we don't want the factual inaccuracies on our website. We're not going to remove a review for difference of opinion, but we will reconsider it if you provide counter facts in writing that substantiate that the review is factually inaccurate. Now, if a review doesn't have any guideline issues or there's no valid removal reasons, take the opportunity to publish a response. And separate from taking action online, consider also your offline options. Is it possible that you have a manager or a leader in your company with the skills to effectively and professionally follow up with the reviewer to address their concerns? You don't want to escalate the situation, but if you have someone who can professionally follow up, that is ideal. This approach obviously requires you to know who the consumer is, and some sites, including Caring, allow consumers to remain anonymous. So, offline follow up with the reviewer isn't always possible. But one thing that is always possible with any review about you online is the opportunity to learn from that feedback. Online reviews can help you understand what's working well in your existing services and operations, and even inspire ideas for expanding your offering. They can also help you identify improvement opportunities, constructive feedback to explore and address service deficiencies, and improve the quality of your offering. Monitoring and learning from online reviews can, in turn, help you better market and grow your business. Now, if you're requesting that Caring remove a review, please keep in mind our policies for removals. This can help save you time and be more effective in your review follow-up. Some of these policies are the same on other sites as well. First, consumers can retract or remove their content from your listing with or without a replacement review. This isn't as common, but it does happen, particularly when the community or the agency has done an excellent job in following up and the consumer wants to publish an updated rating. We've also removed some reviews based on community and agency ownership changes and when the business stops offering a specific service mentioned in the review. Please do not ask us to remove a review if it's old or you think it's unfair or you like other people's opinions more. Each review is evaluated on its own against the guidelines. If you have any questions, please contact reviews@caring.com. Now, one of the most common mistakes we see regularly in contested review cases at Caring is a misunderstanding of review comments that are facts versus opinions. These are some common examples that come up in reviews in our industry. For instance, their billing is terrible is an opinion and likely to upset you and your staff, but it's not a fact-based error if you disagree with it. But by contrast, if they say they sent us a bill for services we didn't agree to and didn't receive, you could contest that as a fact error if your business did indeed have a signed contract for the services you billed. Now, we don't need to see the signed contract. We just need you to send us an email saying that there was a contract that listed all the services, they agreed to them, so that review was factually inaccurate. And that's just one example. There's many others here about staffing, cleanliness, dining, communication, when the comment is an opinion versus a fact. So when you see a review on your caring.com listing, look at the review's content, and if you seek to get it removed, focus on the facts and provide specific counterfacts. I don't like the way they describe us, or this review is wrong, isn't enough to get it removed. It's understandable that you feel that way, but it's not a valid removal reason. We need to know specifically the factual inaccuracies in that review. Now, when following up with Caring, and this is true for any review website, it's important to avoid disclosing any private or confidential information about the reviewer or your customers. Written correspondence about reviews can be subpoenaed if litigation arises involving that review. So it's better not to send any private or confidential information. This includes not sending any private healthcare details in the email messages or in your review responses. Also, please avoid writing any disparaging or defaming remarks about reviewers in your messages to review sites, such as comments about their alcohol or drug use, you or their family members' opinion about their mental health, or how they manage their finances. Sharing those types of side comments is both unprofessional and ineffective for getting a review removed. Now let's get into practical ways to publish responses to online reviews. Any business listed on caring.com can respond to reviews about their business, and it's not required that you be a partner or online advertiser with us to do so. Here are the main options. If your community or agency does have an enhanced listing in our partner network, we send an instant alert via email when we publish a new review on your profile. It is sent to the review subscription emails we have for your account. We're also integrated with review monitoring and response platforms that have a review sharing agreement with us. Any business can use these services, but they do require a subscription to that platform and an account with that platform. So you log into their dashboard and then you respond to reviews, not only on Caring, but other review websites as well. Now, if option number 1 and option number 2 aren't a fit for you, for any review at any time, old or new, anonymous or not, a business can email a response to reviews@caring.com. Include in that message the response you want published, or if you're requesting it be removed, the valid removal reasons. And one thing to keep in mind, our guidelines for published responses are on the same page as the review guidelines. We don't publish review responses that have defamation against the reviewer. We avoid publishing responses that violate privacy. We have a few additional requirements, such as details on who specifically is responding for the business. Now, if you accidentally submit a response that you want to change, or there's been a change of point of view at the company and you need to get that response replaced, simply email reviews@caring. That is no problem at all. This is a sample review alert that Caring partners receive. Inside are details about the review, a link to your listing to see the review on the site, and some links to take action. You can either contest the review or publish a response. There is no login required. You just click the link. It takes you to a convenient pre-populated form. And when you use the alert and those forms, you reach our highest priority response queues, which are typically addressed daily within hours, but no later than 2 business days. If there isn't a valid removal reason, you'll need to publish a response. And we have some tips to help you to ensure your response doesn't do more damage to the reputation than the negative review. You may already know this, but some consumer feedback will be unfair. Sometimes it's even rude. Try to avoid an emotional gut reaction. Stay professional. You don't have to agree with anything the reviewer says, but you can be gracious and grateful for the feedback. After all, they're surfacing something that you may not have otherwise been aware of, and it gives you an opportunity to be more influential than the review itself. Avoid debating the reviewer, and again, don't disclose any private information, especially any details that the senior or family haven't disclosed in the review. Try to be empathetic. Family caregivers and seniors can be grumpy and stressed. You know this. The negative feedback may be more a reflection of their situation than your services, so avoid blaming them in the response. Another key strategy for negative reviews is to get your happy customers to post their feedback too. The balance of having both positive and negative reviews can actually help the credibility or the believability of the positive reviews. People are more likely to believe the positive feedback when they see there's negative feedback as well. Overall, try to have a growth mindset. How can this feedback from this person help our business be better at our mission, at delivering excellence in our services, and ensuring that more customers are strongly compelled to post positive reviews than negative reviews? Another tip, you've probably, if you've been to my prior webinars, this is something I give. You want to keep in mind that you're writing a response that is to a specific review, but you are speaking more to the prospective customer than you are to the reviewer. Their mind may already be made up. It's the crowd visiting the listing, reading your response that may be persuaded more by how well you handle the feedback than by what the reviewer wrote in their criticisms. Try to imagine your review is posted on a highway billboard or a TV advertisement. That may help you in how you craft the wording. It's not, don't think of it as a private conversation between you and the reviewer. Think of it as a public response being judged by anyone on the internet. Another good thing to keep in mind about review response on Caring, and this isn't true for all review sites, but it is definitely true for Caring, we aren't going to publicly date your response. So you can take your time to craft an excellent reply to that review on caring.com. We also, you remember at the beginning, I said some people are afraid or don't want to re-engage the reviewer. Well, with Caring, we don't send an alert to the consumer reviewer when you publish a response. We don't host an online discussion forum around that review. There's no back and forth conversation. We publish the review, we allow one response, and that's it. These are attributes of our review response feature that can help you manage your reputation with greater ease and well-crafted responses so you can avoid making matters worse. Here are a few examples from public-facing reviews and review responses on caring.com, and I've made sure to include a couple anonymous reviews because I definitely get the question, how can I respond to that? It's anonymous. The tips I've provided are for any review, whether you know that person or not. These are all real reviews, and the businesses didn't approach this feedback with dismissal or defensiveness or claims that it was their competitor or disgruntled employee. They show appreciation for the feedback and they invite an offline conversation. After this webinar, you can visit the caring.com directory, do some searches in your area, visit your competitors' listings. Are they responding to reviews? How well are they responding? Responding to reviews could even be an opportunity for you to stand out from other businesses in your area. Most online reviews, believe it or not, most online reviews, not just on Caring, but across the internet, are positive. People think most online reviews are negative, but the fact is most online reviews are positive. Yet, many businesses are skipping responding to positive reviews and only focus on the negative, and that's a real missed opportunity. So when you do respond to positive reviews, here are some best practices to consider. Show gratitude for that feedback. Be conversational, but maintain professionalism. So, for example, avoid the emojis, but be authentic and conversational in your tone. Add relevant information about specific services or company values that receive compliments that can further persuade the prospects that are reading the review and its response, but don't be shamelessly promotional. You don't want to go overboard on that. You just want to subtly reinforce those compliments, add additional information, and most of all, be sure to promote excerpts of those positive reviews on your social media profiles, in your marketing materials, or anywhere that review is going to help you persuade prospective customers. Here are some specific examples of positive review response. These businesses took the time to thank the reviewer, and in some cases, you see, they shared more information about their services that reinforced the compliment without being too self-promotional. And I also included here one agency that used a positive review to make a social share image. I just love this image. Love the little hearts coming out of the chimney of the home. And they included proper sourcing to the review site. That's important for credibility. If you want people to believe that's a real review, link to that review site so they can see it live on the web. And they expressed public appreciation for the feedback by sharing this meme. This is just, there is one sample on this slide, and I'm not going to point it out too strongly, but there is a sample on this slide that has one minor error. The response thanks the reviewer for a 5-star review, but the review is a 4-star rating. It may be that they used a template, and that's how they made that error. And if Like I said earlier, if you see that with one of your responses, contact Reviews at Caring to get that updated. So let's talk about templates and generic replies. Templates are typically used to save time. I get it. And there's a lot of them out there. If you Google how to respond to reviews, you'll see lots of websites offering you templates to respond to reviews. However, templates and generic review responses can go terribly wrong, and many consumers are savvy and notice when you're using the same response to many reviews. In fact, these are real quotes I'm showing you from seniors and a family member that we've seen via the Caring Reviews program. These are just two recent examples. I do periodically get this type of input. Today's consumer is turned off by seeing a business post the same templated response across reviews. It can be worse than not responding in some cases. So try to personalize your response. If the screen name is anonymous, though, do not write Dear Anonymous. That's awkward and impersonal. Skip the personalization if it's anonymous, but if they've used their real first name, you can use it too. Another way to personalize a response is to use at least one specific detail from the review that shows you're paying attention, you read it carefully, you are authentically responding. You're not some response bot, you're a real human who cares about what the customer is giving you in their feedback. And make sure to double check that you haven't left any placeholder text or made the same mistake that I mentioned on the prior slide of commenting on a different rating than the one they actually gave. Another important tip for any of you providing healthcare services is protected healthcare information is among the private information you shouldn't disclose in online review responses. These are tips from one of Caring's Reviews integrations partner, Consumer Fusion. The policy set forth by the Health Insurance Portability and Accountability Act, or HIPAA for short, can be difficult to navigate, and it can discourage some healthcare providers from addressing their online reviews. But as we discussed, you can't ignore reviews anymore, so it's better instead to implement a HIPAA-safe strategy for responding to both positive and negative reviews. Consumer Fusion's key tips are that you should not confirm the person is a patient, and they also emphasize that you should not disclose any personal, private, or healthcare details in the response you post. Like us, they also recommend you avoid arguing with the reviewer, avoid apologizing for healthcare services rendered, as that's confirming the person was a patient. And they also strongly recommend that you take the conversation offline rather than continue that dialogue online. They've provided two samples here of how to respond to online reviews with HIPAA compliance in mind. And one is for a positive review and one is for a negative review. These tips, by the way, are from a blog post they did for partners.caring. If you'd like a copy, reach out to Reviews at Caring. I'm happy to share that with you. And they also do what I talked about earlier of the monitoring dashboard. So they are one of our partners where you can use their dashboard to monitor and respond to reviews. Now, I'm really excited to share this information with you. There is a new tool you can use to help you craft review responses called generative AI. Some of the review response monitoring and response platforms even offer this technology as part of their features now. And here I'm showing you an example from the free online tool ChatGPT via openai.com. I entered a prompt. So I used the tips I shared with you earlier here, and I entered that as a prompt along with the text of a real negative review of a nursing home on caring.com. Within seconds, ChatGPT gave me an excellent response starting point that then can be personalized and further adapted into the nursing home's brand voice and style. They should also ensure that the response is accurate regarding their services. So there's no what we call hallucinations. And you'll hear that term when people talk about AI. Sometimes the machine gets it wrong. So you need to check for that. And then you also want to make sure the response doesn't violate HIPAA or otherwise disclose private information. This new tool can help you overcome writer's block and, more importantly, help you avoid that emotional overreaction. It's common, it happens. You are giving your all to serving seniors, and it can hurt your feelings sometimes, some of these negative reviews. AI doesn't have feelings, so it won't include that emotional response in what they suggest in how you respond. And it also, given the speed in crafting that initial draft, it can help you respond to a large volume of reviews. Interestingly enough, Bright Local, who I mentioned earlier, did a recent study, and people liked the AI generated responses better than the human only ones. But this tool doesn't replace human expertise. It's a supplemental tool that enhances performance. It doesn't replace your staff. How you prompt it can affect the quality of the draft response it provides, and you should definitely proofread, personalize, and adapt that response before you post it publicly as under your brand and company name. So give it a try after this webinar. You may find it very helpful for your team. Now we have a bit more info to share, and then I'm going to open it up to Q&A. You are likely getting reviews on multiple review websites, so I wanted to give you a few tips on some of the major sites we most hear about. First, Google. They don't have senior living and senior care industry experts screening the reviews like we do, but they do have a way for anyone on the internet to flag a review that is believed to be outside the guidelines. You just click the three dots in the upper right of the review, and then you click Report Review, select the reason from their menu, and submit. And your business can and should verify your Google Local profile. That is free and will give you the ability to respond to reviews on their site. Now, if you are a home care agency using Home Care Pulse to build your review collection on caring.com, please keep in mind that they have a unique and separate appeals process, and contesting a review with them doesn't automatically remove it from caring.com. They're also not yet integrated with us for publishing responses, so you need to contact us directly to address the review once it's published on our website. Another thing to keep in mind about the Home Care Pulse reviews is they're regularly talking to the agency's customers, frequently updating those reviews. So if you get a Home Care Pulse review on caring.com, commonly you'll see that review updated 3 to 6 months later, and for some of your long-term customers, repeatedly over years. We do not publish multiple reviews from the same person. We remove the prior review and substitute it with the new review. And for Yelp, any logged in consumer user can report a review. This is like Google. They're relying on the crowd to self-regulate the reviews rather than having industry experts managing the platform like Caring does. Business owners can also log into the app to report reviews, add comments, and even private message the reviewer. But be forewarned, though, on this platform, Yelp has made it very, very easy for the consumer to keep changing their content and rating. So how you respond privately or publicly can immediately impact if that consumer goes up or down with the rating of your business. Facebook, we all know, is a leading social network for boomers and seniors nowadays, but it's a tricky platform, and the recommendations feature takes a higher level of online reputation management expertise. If you don't have excellent online community managers maintaining the integrity of your page every day, I would consider turning off the recommendations feature for your page. I've seen consumers post disturbing images that seemingly violate seniors' medical privacy. I have found it hard to get Facebook attention on some of these matters, and I've seen that consumers can pile on the comments, creating a mob environment against the business. So keep that in mind. If you have that feature turned on for your business, you need to monitor and have skilled reputation management professionals responding to those reviews. And Google and Yelp, or like Google and Yelp, Facebook also has a report this post feature, but it is not relying on experts to report those violations. Okay, Savant is another review monitoring and reputation platform that's integrated with Caring, and we invited them to share their tips with you today for review response. They are encouraging businesses to pay close attention to the review alerts and respond quickly. This is true particularly for the review platforms that are publicly dating your review response. And the guidance that we shared earlier is aligned with what they're suggesting. Thank the reviewer, express empathy with any issues raised, and take the conversation offline to provide resolutions. They also encourage you to share the reviews to build trust, and one great service they offer is a review reprint widget for your website. So Caring reviews are included in that service. Okay, so we have come to our Q&A portion of our presentation, and we got the number one question that we normally get, and that is, will there be a copy of this presentation available? The answer is yes. We will also make a recording available. Again, I apologize for any audio issues close to the beginning. The recording should be complete if you missed anything. Okay, so let's see. Are there any other questions? Okay. We got a funny joke that AI conducted the study I mentioned comparing an AI response to a human response. That is funny. But no, it was humans, and that was valid feedback. And you may have seen in the sample I provided how well that ChatGPT crafted a response using the information I gave it. But thank you for that laugh. I appreciated that. Okay. Here is a question about sharing reviews. So is there a link to share reviews with tours of the community? All reviews on, and this varies by website, but on caring.com, all the reviews are public showing. So if you share the link to your profile, and there is we now have a button at the top of the profile to click right to the reviews, and that updates the URL to the reviews section. So you can use that URL to give people directly to your reviews on caring.com. And similarly, while we're on the subject of sharing that profile, there is a dedicated review submission link that you can share to get reviews on caring.com. And if you are the person that asked that question, email reviews@caring.com, and I will provide you, or my team will provide you, the link that I'm referencing, both links, showing them the reviews as well as how to get reviews. Okay, we got a question on who do we contact to get our office on board as a partner with Caring. That is a great question. I love questions like that. It depends on if you're a home care agency or a senior living community. But as a starting point, to make it easy for you, reach out to reviews@caring.com. I will help get you connected to the right people and make sure you have information about how to get and respond to reviews on your profile right away. Thank you for asking that question. Okay, here's another question we got. Is there a way to remove reviews that were made regarding a previous owner? Absolutely. We don't clean slate with the ownership changes because some of the reviews are still relevant. It really depends on the circumstances of the ownership change. But reach out to reviews@caring.com. We are going to take a look. Let us know the month and year of the ownership change, and we will take a look at the prior reviews, and any that reference the prior owner, the prior management, or prior services under the prior owner, we will take down. We also remove prior owner review responses. So let us know if there has been an ownership change. We do want to reevaluate whether those reviews are still relevant and which ones need to get removed. Thank you for asking that. So we got a question about a third party review monitoring platform that says they aren't yet integrated with Caring's reputation dashboard. How do they get integrated? That company can reach out to reviews@caring.com. We have a review sharing agreement and we have a process we go through. And it doesn't take a lot. We are looking forward to adding new partners all the time. So that company that you mentioned should reach out to reviews@caring.com, attention Denise Graab, and I am happy to help them get an API token and be able to have Caring reviews integrated in their reputation platform. Okay, we got a question about that the person believes that they used to be listed on caring.com and they don't seem to be there anymore. Reach out to Reviews at Caring. I can help you find the listing or get a free basic listing set up for you to host those reviews. Thank you for letting us know. There might be an issue there. Okay, let's see. Are there any other questions here? Okay, I'm not seeing any at this time, but if you are like me and you wake up, oh, here we go. Um, oh, I love this question. Okay, this question is, will you ever have a dashboard where you can see all the reviews for each of the communities and respond, and also see data on the number of reviews and keep track of where you are with reaching the award? I am so glad you asked that question. We are working on that as I speak. We hope to have reviews in Partner Portal by the end of the year, the ability to respond to reviews, and we are also looking at reporting on reviews too. But in the meantime, reach out to Reviews at Caring. I have reports I can provide with you on your current review status and where you are with regard to Caring stars. We got a question about pricing, and I'm glad this came up. The reviews program on caring.com is free of charge. There are no fees charged to get reviews. There are no fees charged to respond to reviews. You can join our referral network, and there are fees related to that separate from the reviews program. Contact Reviews at Caring, and I will get you connected to the correct staff to help you either upgrade your listing, get listed, or let you know if you're already a partner and just didn't realize it. But in terms of the third-party review monitoring and response platforms I mentioned, pricing varies. Some of them have their pricing on their website, like Review Trackers even has this great widget, if you will, where you enter how many locations you have and they tell you their monthly price based on the number of locations, and it gets cheaper the more locations you add. Reputation.com has custom pricing. It just varies really. So contact those third parties directly for their pricing. Thank you for that question. And what I started saying is, if you're like me and you wake up in the middle of the night, you're like, oh, shoot, I should have asked that question. It is never too late to contact my team to ask a question. After this webinar is over, reach out to reviews@caring.com anytime. We welcome your questions, your feedback. We are here to help you. So now I would like to summarize the key stats we discussed, or key information we discussed during this presentation. And hopefully I have impressed upon you that in 2024, responding to reviews is expected and can be very influential and even help you win Service Excellence Awards. And for negative reviews, you can be more influential than that review based on how well you respond. And you want to review to make sure you don't get disqualified from Caring stars. So respond to any and every 1-star or 2-star review you get on your caring.com profile. Should do that year round, but make sure you do it before October 15th. And then it's important to regularly monitor and manage your reputation. There's tools to help you. If you're limited in staffing time, you need to prioritize the highest ranking, most popular review sites for your business. And then be familiar with the guidelines and options for each of those sites that you're focusing on. Always follow best practices, stay professional, avoid overreacting, be gracious and empathetic, honor HIPAA. And there's other laws and guidelines I mentioned. Take an opportunity to make a positive, lasting impression. And caring, I've mentioned this a couple of times, but I'm known for emphasizing this. We are a very high integrity platform. Our guidelines are applied fairly to all reviews, all ratings, all listings. If you ever have a question, reach out to my team by email or phone. I greatly appreciate you taking the time to join the presentation today. You're going to be prompted to take a survey. I hope you will. It takes only a few minutes, and every survey, I just get so many valuable ideas and insights from people that take the time to share that feedback. Really appreciate it. Here's how to reach my team. I mentioned partners.caring.com a couple times. There's lots of resources on there, not just the reviews. So with that, I thank you. Have a great day.